These are my disclosures. The only one that's pertinent is I do work with Smith & Nephew and get royalties from them. So if we look at arthroplasty volumes, they're continuing to increase. As we've seen from 2012, the primary volume's gone up 37% and actually an increase of 14% since 2021. So if we're seeing where these patients are going, we all see they're going now to the ASC with a 50% increase in volume over the past year. And who are these patients? We've got the marathon runners, we've got the yoga, we've got very diverse BMIs, predominantly in Kentucky and the South, and then the erector set for the spine and trying to prevent some of the complications predominantly at an ASC. So with these increasing case volumes, the last thing you want is to have complications at the ASC where you cannot get the same day discharge. So if we look at joint-related complications, total hip and total knee are a little bit different. Total knee, we see a little bit more issues with some of the medical complications. From a total hip standpoint, we see more issues with dislocation, periprosthetic femur fracture, and wound-related issues. So again, trying to mitigate some of these issues is paramount to get in that same-day discharge and prevent readmission. So what is really needed for the total hip of the ASC to prevent some of these issues? You need an excellent cup with reliable fixation. You need multiple liner options, whether it's highly cross-linked poly or dual mobility. Also, from a femoral stem standpoint, you want to remain somewhat agnostic, whether it's approach. So I'm predominantly a DA surgeon, but using a stem that can also go through the back as well. You want collar to collar options and then a seamless transition to cement if needed. I know we don't talk much about cemented stems, but I think it's something that we need to start to think about, predominantly in some of the older patients if we're doing these at the ASC. So if we look at acetabular cup options at the ASC, so with the R3 system, it's highly cross-linked poly. You can do oxinium on poly. The stick tight on the coating is wonderful. I mean, you don't have to put screws in. I still put 2 screws in everybody just from a